welcome to season 2, where we are changing things up.
Everything.
Yeah. So, we're just... having a podcast was stressful, and we wanted to look at our goals of what we wanted to do versus what was, like, hard and stressful and not good for our lives to do. So we kind of came up with this new twist on podcasting. I don't know what it is called, but we've made it up, and we're going to start it. Mainly, me and Camille see stuff constantly, all day, in and out, people coming in and seeing us and telling us health things, and we research things and have really strong opinions and get to help people in unique ways. And doing a kind of formal podcast and reining us in is hard, when really I just want people to be able to share the conversations that we have with each other, where we're going through these experiences and learning, and we just want to talk about what we've learned. So instead of doing podcasts, we're going to do more of just conversations.
Less structure.
Yes.
More room for the gray area.
Yes. And then I was listening to other podcasts, and they're all the same, and we're just going to be normal. So we're not going to be like and subscribe. I think people should do that. So, because I don't know why, actually. Everybody says that people should like and subscribe. So, like, I guess we should ask people to do that, but I'm not going to ask you regularly. We'll probably have it somewhere, but, you might want to do that.
Check our social media for those things.
Yes, check our social media. So this is going to be really low-key, us chatting. And a lot of things will be us kind of figuring it out as we go through, because we aren't necessarily scripted. We just want to kind of share with other people how we step through things that we deal with, and we see lots of health issues and lots of things going on.
Yeah.
So I wrote a kind of informal text to, well, obviously texts are quite informal, to Camille here. And I just went through the things that, like, I really want to talk about. So things that I want to talk about. First of all, I want to talk about why the ketone diet even got us to this point. So we've talked about this before. Like, we're not just teaching, like, weight loss skills. Those skills that cause good weight loss are really just really good life skills.
Lifestyle skills.
So we kind of evolve out of this ketone diet into just these life skills, and so we still like these principles, and there's a reason that we really like these, and we'll probably bring those up as we go on. But it's more life stuff. So there's some life things that I want to talk about. So let me pull up our text, because I don't really know. Oh, so I think what we're going to do format-wise is we're going to have these conversations, and we're going to put just pretty much the whole thing on YouTube. So you can just listen through the whole thing. We'll maybe get distracted, and then we're going to do a podcast format where we edit those conversations and do it more of a streamlined, here are the highlights of the conversation that we had. So kind of either way that you want to listen to the whole thing, which may get weird, or you can
Probably will.
or you can listen to the more structured thing. So sometimes if we just sit and stare at each other for a while, we might afford that. But, alright, let me just pull up this list here that I made.
So I think going off of what you were saying before, the hardest part of weight loss is making it fit into your lifestyle.
Yeah.
Like, that's why these things feel so unmanageable, because you've got to add all of these things to your already hectic life.
Mm-hmm.
So I think, if we just talked about calories or food or exercise, like, that wouldn't really actually be serving the community of people that we see.
I agree. Like, it's nice in a podcast to say we have this topic, but really, in reality, when we're doing it is all so integrated that it's hard to stay on that topic.
And it's hard to separate, like, who we are as people and what we're going through in life and how that applies to this program as well.
Yeah. Well,
so, like, it all kind of comes...
I think I have a great example of this. So the next thing that I was going to say is, like, okay, let me just read my note to you, and then I'm going to tell you, I think, how we are going to do exactly what you said. So I said, I wanted to, this is totally unedited, so that's going to be the thing now. You're just going to see how I text, okay? So I haven't read this in like 2 weeks. I want to discuss what a provider actually is supposed to be. The history of humanity in healthcare and how it really is a collaborative art project meant at making you a happier person. How the whole drama at the doctor's office is stupid, and we really should just be humans who connect and use our shared knowledge to form the best path. I want to discuss how much I hate online telehealth doctors. When you have an open conversation with me, it will help you in. Well, an open conversation will help way more than just sending a message to the provider online. And I think that the art of medicine is being replaced by consumerism. So, something, we talk about our normal lives. Well, I'm having this situation. So, in May, I'm being honest, in May, I had this pack come back that says I need to go to the gynecologist and get it tested. So, I'm like, okay, that's so expensive. So, I'll just wait and get insurance because I didn't have health insurance. So, I'm like, wait, I'll get health insurance. And so I did. And then it's like, okay, well, it doesn't kick in until January. And I'm like, okay, so I'll wait. So time is going on. I'm getting a little more stressed about this. Need to go in. And then I call the doctor and I tell them I need to get in. I've got this. And they said, we don't take your insurance. And it was like, are you serious? Like, I just went there 7 months to get this insurance and you don't take it. So at this point I got stressed and I was like, Bailyn, will you just help me? So we find somebody to see. But then she calls people and they're like, no, she needs to call and she needs to come in and see us. And it's just this drama.
Yeah.
And like, I hate that. I hate that. I hate that someone can't just walk in and say, hey, I've got these issues. Can we get this tested? Can we get this checked out? Like, it's so much drama to go to the front desk and run your insurance, and then your provider has to see so many an hour. They're not going to make enough money. So you just get punted.
And then is this provider also working collaboratively with your other providers? Because I think that's the worst part of all of it is...
They're not.
Like, I have an elderly family member who has a kidney doctor and a heart doctor and her PCP and her women's health doctor, all the things, and nobody knows what is going on with any of the other providers, and she doesn't know. She's old. She can't keep track of it. They won't talk to us if we call. So there's just
used to
no
know what the
way.
PCP did was manage.
But they don't
care.
now.
They don't anymore. Now they're the punters. They'll punch you somewhere.
Referral.
Then nobody looks at the whole. And that's what, like, our job is supposed to be. We're supposed to listen to the patient, look at all of the stuff that's going on. And so I just hate that. And I'm not dissing the gynecologist because the one I found was great. There was none of this leading up to it was their fault.
Not really the provider's fault.
It's
our system.
It's not. But, like, I just need to talk to her. And so I want to be able to offer that service of people being in and just being able to talk. And then there's so much out there now where it's good to do this and it's not good to do this and it's bad to do this, and so much is your life. And so I want to have an atmosphere where people are able to, where we can work together to come up with the best plan. And I think with the economy that we have, or the suing, everybody's like medical malpractice, you don't even get to do special art anymore. And so I wanted to somehow talk in this not podcast about what healthcare is, and where we are in this state where I can't get, an appointment, and then it's so much stress versus what it should be is this artistic collaborative agreement between people in vulnerable times.
And there's this air of, like, I heard a conversation yesterday, not wanting to tell your doctor about XYZ.
Yeah, that's so silly.
And
I've heard it all. Nothing you're going to say surprised me. And I get excited when you tell me your stuff because it's like, oh, I can fix that.
Right, that's easy. That's a
Yes.
good one. We got that. We can actually pull it from the
You
back
got
real
hair
quick.
growing weird places? I can fix it. You got hair not growing places?
Yeah.
I'm excited about that.
Yeah.
It's so weird when people don't want to tell me things. Or I'll hide things. Like, or go to one doctor and not tell me what's going on. Like, I'm not.
And I think the issue comes down to, like, health insurance dictating everything, right? So I think I've shared with you before I found you as a patient, I had a PCP through my health insurance at my last job. She was like assigned to me through that health insurance. And I'm like super anxious, have a toddler, can't lose weight, not doing great in a lot of different ways. And she just tells me diet and exercise. She's driving in her car. You just need to watch your calorie intake and start adding in exercise. Like, it's just this, like, super easy, why would I even bring up my weight to a healthcare provider kind of conversation. And then you have enough of those interactions with a provider, you're like, why would I tell them anything?
That's true. They just poo-poo it. It doesn't matter. I'm silly. I'm dramatic. Yes. And to me, it's just like, you're suffering for something that I can fix.
Yeah.
Just tell me. And like, I've heard it. I've seen it before.
I feel like we have to, our male patients, we have to always have that conversation with, like, you're not going to scare me, you're not going to surprise me, like, I've seen and heard worse.
Yes, well, like, they'll go to hymns, you know, and, like, because they like that anonymity. But you're going to get so much better care if you just have a connection. But also, there's nowhere in this economy, no place to have that. You know, I knew what I wanted for a healthcare provider, and I couldn't find it. It's not out there. And I think people are now just taking it like that's okay. Like, but we lost healthcare. Like, medicine just disappeared now. But I think a lot of it goes back to getting sued. Like, you're afraid you're going to get sued, so you have to just black and white say the book. It doesn't matter what the person's going to do or what's realistic. It's what's not going to get you sued, what's not going to get you in trouble in court. And that's what you have to write down. Yeah. They just take out, sometimes there are risks. But you know what? If you're an adult and you understand those risks and we've gone through it together, you have that right to make that decision to take a risk.
And we've had this conversation a number of times, just me trying to learn from you and why you're making whatever decision you're making with each different situation. And you're like, I think I'm right here. Like, and here's why. And here's what it says here, so I do know I'm right. Like, I'm doing the right thing. And I feel like you go into it with the patient's, like, what's in their best interest versus
I like what's realistic.
Right. Versus this is the standard protocol for this right here.
And I'll make sure that I think what's fair is that they know the standard protocol.
Yes.
This is what
if
this is what I should say that we do. And I do that. I make sure that we're covered. You know, like, this is the standard protocol. But now that we've got that out of the way, now that you're informed, let's make a decision about you. But then we actually reach that level of healthcare that's realistic healthcare versus this fake healthcare where you're going to tell a doctor and he's going to be like, oh, just lose weight. And then we're not actually going to get the care that we can provide when we're actually doing what we're able to do.
And I think you can have a conversation with literally any person and come to the same conclusion. That, like, our healthcare system just doesn't work.
Yeah,
the way things happen. You walk into a doctor's office, your appointment's at 9 a.m. You don't go back to see the doctor until 10:30 or 11. Just right from that point, you're like, I'm late for work now.
Anything difficult, you're punted. And so it doesn't even matter. You gotta wait 6 weeks till you see the specialist.
So what, I haven't been to a PCP in a very long time. What's even happening at a primary care provider's office now?
They're just seeing so many. They're just coming in and they do sick visits. You know, we don't
Is this to get payment from insurance? Like, is that they're, like, you have to see this many patients per hour?
Yeah, or you're just not able to cover your overhead. And the overhead is insane because you have people for billing. You have, all these people that have to help you.
And your malpractice insurance.
Yeah, well, I still have that. But you have all these things that you have to cover. And so you have to see it, and the insurance is like, I'm only going to pay you this much. Well, the only thing you can do to be able to provide care at all is to get through them. And so I think it just developed into this economy where we have to say what we have to say, we have to get you in, we have to get you out. We don't have time for the overview. But I don't know. I had one patient recently, and she had just struggled with a simple infection for months because no one would actually sit there and listen. And like, we could go back to when it started, what to do, come up with the treatment plan, and we just fixed her, you know? But no one sits and listens anymore. So I don't know. I guess a podcast we would be like, we're going somewhere with that. And here it's just being frustrated. Like, I'm just frustrated that the system is what it is, and I hope that we can offer something different.
And it feels really hard to escape from that. I know we've tried to come up with different plans and ways to offer.
Yeah, how do you even market that? How do you even say, we're different, we actually care about your health? Because how many times have you heard that? And it's still putting you through the same system. So we have all these cool things, but there's no method to deliver it to the public. To even say, we actually care. Like, if that was somebody's slogan, like, we actually care, you wouldn't think they cared. Okay? No, nobody does. And so it's hard to get out there and be like, it's different. But, I don't know. It's what the world needs. It's what we need to do. We just lost the art of medicine, and we need to have a place to bring it back. And so, like I said, I don't know what we're going to do about it. I guess we have a clinic, and that's what we do. But I think, what can people do? So if you're not near us, and you're not, I don't want this podcast to be like marketing about us. I hate to be like, go be empowered, because what does that actually mean? But understand that healthcare could be different, and to find people close to you that are different. I can't be the only person, right?
So whenever I decided I didn't like my daughter's pediatrician, it was like, there has to be a better option out here. Like, I can't walk into the pediatrician's office and leave feeling this way every single time. And there are people out there who do medicine differently, and you just have to ask around and find.
I think so. I mean, I've met another local pediatrician here who does what we do, and she was wonderful. And then I know, I can't take care of myself, so I have a provider here, and they do a similar thing. But I think the thing is no insurance. Find yourself a private pay clinic.
Yes.
That's how you fix this. You find yourself a private pay clinic.
Because the only way you can operate any different is not to accept insurance.
You're right. The only way you can even start off on a different foot is to not take insurance. So I think that's really what you're going to have to look at. Because then,
if we were insurance based here and we wanted to be doing the same thing, so getting our patients on a GLP medication and guiding them through that process, we would have to start with a prior authorization, and then we would probably need to try metformin for roughly 90 days. And then if that failed, we would need to try, I don't know.
They're going to not follow what's the best.
We've got to try. It'll take us a year to get to the point for a lot of people that we could actually start you on a GLP medication. Versus, we don't accept insurance. You come in here and you're appropriate for the medication. You can get started.
I think maybe that's one a part of the allure with like hers and Hims and all of those online things too. But so start with private pay, because that's and so private pay, like we've talked about this a lot, like and broken this down, and I think there's a way that you can do private pay safely. So they have those like catastrophic plans, right? Like you get in a really bad wreck and you need surgery, or you get cancer, if something goes on, you need a catastrophic plan, like, because nobody can afford a $2 million hospital bill. But you can get a catastrophic plan that's pretty low, and then you you set aside money every month to do a private pay concierge service, and then you know that maybe something's going to happen in the year and you have to do an MRI or pay for something out of pocket. So, make yourself a little cushion, but, $1,000, $1,500 that you're going to have to pay. Then you pay your concierge fee, your low insurance premium for catastrophic. And I feel like that's the best best way to get good
Mhm.
care. So yeah, knowing that there are options, I really would recommend private pay shopping. And if you don't like the vibe, try again.
Mm-hmm.
Like, you're gonna end up just getting bad care because you and the doctor aren't gonna agree, and then you're just gonna shut down, or he's gonna shut down. So shop around.
And I feel like maybe, I don't hear about it a lot, but maybe there is a shift starting in healthcare by the providers who aren't accepting insurance.
I hope
Because
so.
that's becoming a lot more common to see, like, these membership-based.
It's not even a shift. It's us holding fast that this is how you're supposed to do it.
Right, like the wrong shift was made, and we need to go back to how things used to be.
Yes. Yeah, the shift is wrong. So I guess, when you're seeing this and you're feeling like this is not right, it isn't right. It isn't right. You're not supposed to wait in those lines for hours. You're supposed to have a connection with your provider. You're supposed to like them.
Mm-hmm.
I remember my providers that were good over the years, like Dr. Jabara. So if you're out there, Dr. Jabara, like, I'm the one who made you sperm cupcakes.
Oh gosh.
Yeah.
You would.
Yeah, he was leaving. He was moving away, and I was so sad. He was my infertility doctor. And so I went to the grocery store, and I got some cupcakes, and I said, can y'all draw sperm on them? And full blastocysts. And they said no.
Uh-huh.
They wouldn't draw sperm and blastocysts. Like, that's bad. So I asked for a piping bag.
Just let me do it.
Yeah. And so I got him cupcakes, and I popped on a little blastocyst and a little sperm, and he went on his merry way, and I was sad. But you should have a connection with your provider.
Yeah.
Like, that's not too much to ask. And if you're not getting it, and if you're not, my guess is you're still paying quite a bit for that crappy service. So whatever you're paying, find somebody who'll listen. So that's something, like, that's just something that I wanted to branch off, and you talk about we're going to go off our life experiences, and I think this is a good one. Like,
and I think that just kind of sets the tone for, like, kind of how we think about things.
yes, yeah. I don't like to be called, like, what are those, like, wellness or whatever, because I'm very, very traditional healthcare, but I'm so traditional that I'm not new age. This is crap. Science is awesome.
So a lot of people come in here, and if they haven't met you yet, like if I've got started with the conversation, they're like, oh, so she's kind of like a holistic nurse practitioner. And I don't think that you're not a holistic.
Yeah, well, holistic
not in
isn't
the way
word.
that people use that word.
Not in the way that
now.
people use that word, yes.
I'm
not alternative.
You might have like some holistic leaning options, or
so I hate that they've used this word.
it's really taken away from what it actually means.
The word itself means the whole system, taking care of the whole system. And so I'm like the most holistic, but holistic has this feeling of alternative, more
like
natural
prescribe
path.
Supplements.
Yes,
and we do use
I do
supplements
when that's the right situation. But sometimes straight up science is the right situation. But sometimes you need someone to think through the science as it applies to you. And that's what we don't have anymore. That's what healthcare or providers don't do anymore.
You're never looking at like a little black and white decision tree.
Yes.
Like, does patient have this? Yes, then this. Like, that's never what you're doing.
Companies do.
Yes.
Like, that's how you do it when you're in an insurance clinic. So, yeah. Okay, so I feel like that maybe turned into a rant. I was trying to explain all the things I wanted to talk about, and I ranted. But that was an appropriate rant that I wanted people to know. Okay, so other things that I want to talk about. We'll just do quick notes here. I wanted to talk about, on this podcast, we see this stress in women, like across Facebook, and just this modern stress put on people. I do want to say women, because we're talking about women, and I don't mean to exclude the men, it's just that I'm not a man, and so I can't really speak for the men, and so I'm not paying attention to the societal pressures put on men. And
I don't know what social media is like for men.
Yes, I've never been able to experience through that lens. So I'm not it's not. I am trying to direct it toward the ladies, and it's not like the men are excluded. It's just maybe I'm totally wrong about how the men would think about it.
Mm-hmm.
But I feel like there's these insane like requirements to be a woman nowadays, and a mom, and anything that you're supposed to be. And I really want us to kind of tackle those issues. Oh, and then the other one is I really want us to be able to start tackling ketamine, psychedelics.
I'm excited to talk about that.
Yeah, and this is a really good example of like I'm not naturopathic or holistic, but I'm open to all the different options, and I'm willing to check new science. And there's so much new science about ketamine, and I think it's just a really cool thing that I want to be able to expose people to.
Mm-hmm.
It was cool that I found it in my life, and I think you are going to try sometime soon.
Yes.
So I would like to kind of follow your experience and see how that goes. So that's kind of what we're gonna tackle. But then we're also just gonna deal with like what comes up when we see these Facebook threads.
Mm-hmm.
We see these and they kind of just like get us going, and so that's where it might get boring because we may just play the camera for a while and do our work, and then something interesting pops up, and that's usually kind of how it goes. So also though, it really is not for us to talk; it's for everybody to learn.
Maybe learn something.
And engage. So talk to us, tell us what you want to know, tell us what you want to hear. But just know that like season 2 is going to be not just about weight loss, and a lot more chill.
Yeah.
From the most chill podcast I think I'd ever seen.
Because we're not real formal people.
No. And trying that just makes me fail, and then I feel like a failure, and then
we're weird.
Yeah, because you're not good enough.
We're trying to maybe not be weird, but we actually are weird, and it reads as more weird than.
Yeah, so you might as well just admit to it and just do it. So. Yeah. Okay, well then, we're not gonna stop because we're done, but we're probably done.